Good evening. Tonight we're gathered for the last Longwood Seminar of 2019. So welcome. I'm Gina Vild. I'm the Associate Dean for Communications and External Relations at Harvard Medical School, and I'm just delighted to see so many people here tonight. And tonight we're going to talk about sleep and why it matters. And I know for certain that this is an important issue and concern for all of us because it is the most frequently requested topic of the Longwood seminars each year. And so we're really thrilled we were able to put together 3 of Harvard's leading experts to talk to you about it tonight. The topic affects all of us because we know that without sleep, our body and mind are not at their best. So raise your hand if you feel you need more sleep in your life. Okay, we know why you're here. An estimated 50 to 70 million Americans suffer from chronic sleep disorders. The Centers for Disease Control and Prevention recently declared sleep disorders to be a public health epidemic. And research has found that lack of sleep reduces our ability to concentrate, think logically, and to remember.
And so we're carrying around at all ages this burden of sleep deficiency. And it affects us in many, many ways. One of the things that I like to think about as a barometer of how sleep deprived we are as a society is just how many people are struggling to stay awake when they are driving. So every month, about 56 million Americans admit that they're having difficulty staying awake when they're driving. About 8 million of them lose that struggle and actually fall asleep at the wheel. And then that causes about 1 million crashes every year, 500,000 injuries every year, and about 55,000 of those are debilitating injuries that leave people either quadriplegic or seriously injured in some way. And it causes nearly 7,000 deaths every year. In fact, 1 out of every 5 car crashes is related to sleep deficiency in some way. And so, it really represents a very serious problem. Maybe if I stand over here, it'll be less problematic. So the question is, why is it that we even need to sleep? And sleep fulfills many different functions in the brain and in the body. It fulfills basic biological needs in the brain in particular. The brain uses more energy than any other part of the body. It's only 2 to 3% of the weight of the body, and yet it uses 20 to 30% of all the energy that we use. Professor Stickgold is going to be talking about the importance of sleep on our ability to remember things, on memory consolidation. Sleep is also critical for us to be able to maintain our focus and attention and alertness, so that if kids don't get enough sleep before they come to school during the daytime, then they're not going to be able to focus and pay attention in class. One of the reasons why there are so many drowsy driving crashes is that our ability to sustain our attention at a task like a routine, highly overlearned task like driving is going to be greatly impaired if we have not gotten the sleep that we need beforehand. So our reaction time, instead of being a quarter of a second, for example, will be 3, 4, 5, or 6 seconds, and the average reaction time will be 3 times longer than it is if we are alert. And so that can have real consequences. It can have consequences at all different ends of the spectrum. Athletes, even top professional athletes, their reaction time will be more sluggish, and they will get fewer. The basketball teams will get fewer players, will get fewer free throws in. The tennis players will get fewer serves in, and the runners will not be as fast when they haven't gotten enough sleep. And also, as Professor Stickgold will talk about, the different stages of sleep are associated with the ability to integrate what we have learned with what we knew before, and provides a critical function for that. But one of the other functions of sleep is, as I mentioned, there's this furnace using all of this energy in the brain, and it is during sleep that we replenish the energy that we have used up during the daytime. So think about that when you're sort of waking up and saying, I can't function unless I have a cup of coffee. You would function better if you actually got the sleep that you need rather than papering over that situation. In the brain, if we don't get the sleep that we need, then we can't fulfill some of the key biological functions of sleep. And you can see the changes in this diagram. You remember that for a while that this is your brain on drugs. It was advertised on TV all the time. Well, this is your brain without a night of sleep. And you can see very specific changes. So this is energy utilization, and you can see in the area of the brain that's responsible for judgment, you can see that it is low on fuel, and so it is getting stone cold there, and that's one of the reasons why people who are not getting the sleep that they need are often exhibiting poor judgment in the decisions that they make. There's also, this is the area of the brain that relays sensory information from our vision, touch, and other senses to other areas of the brain. And this is the area that receives visual information. And we miss 10 times as many signals in our visual field. And that's one of the reasons why we have accidents when we're driving, because we don't even see the things that are happening. So we are much more likely to miss things that are happening. That's why it's so dangerous to have, let's say, an air traffic controller who is responsible for seeing the planes on the visual field from a monitor, because they're not going to be able to pick them up as readily. And so this is one of the... Now, another really key function of sleep that has just only recently been discovered has been the clearing of toxins from the brain. So this high energy utilizing organ, like any other, anything else that uses a lot of energy, there are some byproducts, metabolic byproducts of energy that are essentially debris in the brain. It's kind of like in your car, you begin to build up sludge in the oil, and you need to change the oil and get the sludge out. Well, in the brain, we build up toxic metabolites like amyloid beta and tau protein. And if we don't clear those out, they can be toxic to neurons in the brain. And that's one of the things that's associated with, for example, Alzheimer's disease, is amyloid beta plaques. And it is during sleep that these newly discovered lymphatic channels actually expand and flush out these toxins when we are asleep. And that turns out to be a critical function of sleep, and once this was discovered in 2012, it began to make people realize why there was an association with both sleep disorders and with people with insufficient sleep with an increased risk of Alzheimer's disease and other degenerative brain diseases. So one of the key functions of sleep is to help you maintain a healthy brain where these toxins are cleared out. Another key function of sleep is, and this has only been recognized in the last 20 years, that sleep is not only important for the brain, but is also critically important for the body. And so the cardiovascular system depends on sleep. It is during sleep that the heart is able to recover with a lower blood pressure and lower heart rate that happens during sleep, and repair can take place during that time. And people who don't get whose sleep is either interrupted or who get an insufficient amount of sleep, they will begin to have higher blood pressure. And sleep disorders, like sleep disordered breathing, sleep apnea, is the leading known cause of high blood pressure. And so anybody who is diagnosed with high blood pressure should have an evaluation to find out if they have sleep disordered breathing, for example. But even adolescents, even teenagers, if their sleep is disturbed or fragmented or insufficient, they will have higher blood pressure than their peers, so they are on the road then to hypertension. And sleep also turns out to be critically important for our resilience and our resistance to infections. So the immune system is affected by the sleep that we get. They have only half the antibody response than they have if they are sufficiently well rested. Similarly, during the winter, if you're exposed to the rhinovirus that causes the common cold, you'll have a 200 to 300% increased risk of actually catching a cold if you're getting an insufficient amount of sleep or if your sleep is fragmented and disturbed. So consolidation of sleep, getting a sufficient amount of sleep, are both important for your immune system to function effectively. And that may be why, that may be one of the reasons why sleep fragmentation is associated with an increased risk of cancer and an increased rate of growth of cancer tumors, because the immune system is being recognized as playing a more and more important role as we begin to understand it in the prevention of cancer. Now, sleep is also critical for regulation of appetite. People often talk about the freshman 15, which is sort of the gain in weight that occurs oftentimes when kids start college. And that gain in weight may be associated with the increased or the decreased amount of sleep that kids get when they go to college. So when we are having these hormones being released that make us more hungry and less satisfied with what we have eaten, then we are more likely to overeat when we are sleep deprived. And then people gain weight. And then one of the other amazing things that happens when people are sleep deprived is that in terms of metabolism, the effectiveness of insulin is reduced. And glucose levels go up to a higher amount in response to the same meal. So now you have a situation where people are gaining weight, and the response of the metabolic system to food is impaired. And this puts many people on, and may be contributing to the epidemic of both obesity and diabetes because of these metabolic changes. And because this increase in obesity and diabetes that have happened over the last 20 to 40 years have paralleled the decrease in sleep duration in our population and the increased problem with the epidemic of sleep deficiency in our society. And amazingly enough, even fat cells need to sleep. So that if you biopsy fat cells in people who are well rested, and biopsy fat cells from those same people when they have been chronically sleep deprived, the ability of those cells to respond and metabolize glucose is actually impaired from the individuals if they've been taken from individuals who are chronically sleep deprived. So the whole body is affected when we don't get enough sleep. And that's one of the reasons why I'm going to argue that it's important to make sleep a priority. But it's not just the brain and the body, but even our emotions. We become much more volatile when we haven't gotten enough sleep. The risk of depression increases. The risk of suicidal ideation, anxiety disorders increase. Our ability to avoid flying off the handle when we are faced with an emotionally challenging situation becomes impaired, because and this has been studied here at the Harvard Medical School by looking at brain scans. The amygdala is a region of the brain that is responsible for emotional responsiveness. And so people in a scanner have been shown disturbing images, and the response of the amygdala is 10 times greater in individuals who've missed a night of sleep as compared to those same individuals who are more calm in their response to these disturbing images if they have gotten a sufficient night of sleep beforehand. So it sets up sort of a perfect storm for situations in which we would not really want to place our children. And the parents of very young children will often say Johnny or Susie is they're not themselves today, they're crying, they're fussy, because they didn't sleep last night. So parents realize that for very young children. The teachers realize it for the 5, 6, and 7-year-old, but then somehow we think that children grow out of it and they don't need to sleep. But that's just not true. The behavioral manifestations are more subtle, but they are just as serious. So we have a situation today in which 1 out of 5 boys in high school is diagnosed with attention deficit hyperactivity disorder. Now, the symptoms of ADHD, the symptoms of sleep deficiency, can masquerade perfectly the symptoms of ADHD. So difficulty focusing attention. We already see that that's one of the consequences of sleep deficiency. Emotional lability. That's another one of the consequences of sleep deficiency. Difficulty keeping your anger and under control. another symptom of sleep deficiency. So yes, there are children with ADHD who need to be treated. But there are many, many more children who don't actually have ADHD, but they're misdiagnosed for ADHD because they're not getting a sufficient amount of sleep. And because it can't be that 1 out of 5 high school boys has this relatively uncommon condition. Now, as I mentioned, there are many, many different consequences of sleep deficiency, and I've just put a few of them on this slide. I've talked about the vaccination response, our distractibility, the increased risk of depression and suicidal ideation. Parents who don't set a 10 p.m. bedtime for their kids in high school, their children are at significantly greater risk of depression and suicidal ideation. Now, one thing that sometimes motivates kids, I was driving home a babysitter, and he was about 14 or 15 years old. And he said, "What do you do?" And I said, "I do research on sleep." And he said, "What a waste of time. I try to get as little sleep as I can." And I said, "Okay." I said, "It's during sleep that you release the hormones that turn you from a boy to a man." And the next week, his mother called me and said, "What did you tell my son?" And I said, "What do you mean?" She said, "Well, he's become a sleep czar. He's like, 'Mom, turn off the radio. I have to go to sleep. You're disturbing my sleep,' and so on." And sometimes when I tell the professional athletes, I say, if you sleep 4 hours a night for a week, you decrease your levels of testosterone by an amount that's equivalent to 11 years of aging. And they're like, "Whoa, maybe I should pay more attention to this." So let's talk a little bit about sleep disorders. So, and one of the most common ones is insomnia. Another very common one is obstructive sleep apnea. It affects about 1 out of 3 men and about 1 out of 6 women. So it's a very common condition, which snoring is one of the most common symptoms of obstructive sleep apnea. And it increases the risk of cardiovascular death by an astounding 420%. And I'm just going to show you a slide that depicts survival. So this graph starts on the left when the participants in the study were about age 48 on average. And it follows the percent who are surviving. And the ones in white are the ones without sleep apnea, and the ones in red have sleep apnea. And we're going to follow them for 18 years when they would have been 66 years old. And you can see that at the beginning, there's not a very big difference between them. I mean, there's only about a double the risk of death. But then you see that the risk of the percent surviving is dramatically lower in those with sleep apnea. So by the time they would have been 66, only 58% of them are still alive, as compared to 94% of those without sleep apnea. And sadly, those who survive in the untreated sleep apnea group here, they get cognitive impairment about 10 years earlier and Alzheimer's disease about 5 years earlier than those without sleep apnea. So it's a real serious condition. You're not going to have good quality sleep, and that will interfere in your ability to function as well. If we do get the sleep that we need, then we're going to be more alert, we're going to perform better, our athletic performance, our cognitive performance will be improved, and we will also, just as a side note, we're actually more attractive to other people. There's a study published in the Journal of the American Medical Association in which they took portrait photographs of individuals when they had gotten a sufficient amount of sleep, and then when they had stayed up all night. They showered, they were all cleaned up for each of the 2 portraits, and people could tell within 4 seconds they were more attracted to the same person who was, and these were 700 images. They've done a very systematic study. But they found the people who had slept to be more attractive. They wanted to spend more time with them, et cetera, than the people who were sleep deprived. So there are many pluses to getting the sleep that you need. And I thank you for your attention tonight.
Here's what we know. We know that rats die without sleep. If you sleep deprive a rat for 2 weeks, it will invariably die. So rats need it. The same is true for humans. Now, Harvard Medical won't let us do that particular experiment. But there's a genetic condition known as fatal familial insomnia, which says it all. It's a prion disease. Harvard's gotten in my way here, so I can't. Can you people see the bottom of the? Some can and some can't. So there's one amino acid here. Oop, that's the wrong button. Back. There's one amino acid that's mutated in this protein. It's a prion disease, sort of like mad cow disease, except what it does is it causes people in midlife, in their 40s and 50s, to slowly lose the ability to sleep at all. And within 1 to 4 months after they stop sleeping, they all die. So humans need to sleep too. Food regulation, Chuck mentioned also, and learning and memory. But over the next 2 weeks, you see this effect. So that by 28 days, people who were sleep deprived for 1 night will have only half as much of an antibody production against the hepatitis, making you much, much more likely to not have sufficient immunization to protect you. Chuck mentioned the effects on insulin regulation. This is a study with subjects, college students, being restricted to 4 hours of sleep a night, not total deprivation, but 4 hours of sleep a night for 5 days. And after that, the rate at which their bodies could clear glucose out of their blood was reduced by 40%. The acute response to insulin was down by 30%, and they looked pre-diabetic. So just 5 days of half the normal amount of sleep is enough to make you look like you're getting type 2 diabetes. And Chuck talked about that clearance of metabolites from the brain. Beta amyloid is one of the 2 proteins that accumulates outside of the cells in your brain that is tightly linked to the development of Alzheimer's disease. And when you are asleep, you're clearing it out of your brain twice as fast as when you're awake. And even a single night of sleep deprivation leads to a measurable increase in the burden of beta amyloid in the brain. So I want to talk mostly about sleep-dependent memory evolution. I call it memory evolution because we used to talk about memory consolidation, this idea that you form a memory and a few hours later it's sort of cemented into your brain and then it's there forever. But if you have a spouse of any gender, you're aware of this phenomenon that as time goes on, your memories of events separate. Usually it's your spouse's memory who gets worse, right? But that sort of constant changing of our memories over years and years is what I refer to as memory evolution. And it's not just whether you remember it or not, but the details of how you remember it. So here's an example. Actually, this is something that Chuck referred to also, about the impact of sleep on just your ability to remember, in this case, just words. Here's the protocol. Subjects either are sleep deprived for a night. Too many buttons, not enough time. Are either sleep deprived for a night or get a normal night of sleep before coming into the lab to be exposed to a couple of hundred words on the screen. They're neutral, negative, and positive words. They're just asked to indicate, is this a positive word or a negative or neutral word? And then unbeknownst to them, when they come back a couple of days later, they receive a surprise test. It was not unbeknownst to them. Here, it was only unbeknownst to them. There. So they give them the test, and it's a simple recognition test. They show them all 200 words that they had seen before, plus another 200, and ask them, which have you seen before and which haven't you? And here's what we see. In the group that slept well the night before they encoded it, memory recognition is quite high, both for the positive words and the negative words. It's reduced substantially for neutral words, but that's something we know a lot about our lives, that we remember the emotional parts. But when we test them 2 days later, when we test the ones who were sleep deprived, and again, they're being tested after 2 full nights of recovery sleep, so they're not tired anymore. When we test them for their memory, Their memory for the positive words is reduced about in half. Their memory for the negative words is reduced about in half. But their memory for the negative words is mostly maintained. Meaning that if you were sleep deprived when you saw these words, you are twice as likely to remember the negative words as the positive or neutral ones. So when if I'm in the psychiatry department, if someone comes into the psychiatrist and says, my wife says I have to come and see a psychiatrist, she says I'm depressed because I only remember the bad things that happen. Truly, he may be depressed, but he might also just be sleep deprived. That's enough to give you the sense that only the negative things are remembered. That's bad on the individual level. It can be catastrophic on the national level. I have this suspicion that the entire cause of the first Gulf War, seriously now, was this effect. Because you had decision makers who were highly sleep deprived trying to decide whether we should attack or not. And they're remembering, we've got these satellite photographs of these trucks that might be biological warfare, weapon development trucks. We've got to do something about it. And they forget they were also told that they looked like falafel trucks too. And that's kind of funny, but that's where our mind goes when we're sleep restricted, when we're sleep deprived. And the decisions could be made on that basis of an over remembering and over dependence on negative memories. Now that's what happens when you're sleep restricted or sleep deprived before you learn something. What my work is really focused on, and what's really quite surprising to me when I found it, and to most other people, is that the sleep you get after you learn something is probably more important than the sleep you get before. What we find is that if we retest these subjects after 3, 6, or 9, or 12 hours, there's no improvement in how fast they can do the task if they're awake during this time. But if we let them sleep between training and testing, they're about 15 to 20% faster. Doesn't matter how long the time interval is, it only matters whether they slept or not. And in fact, we can wait even longer to test them. These are groups of subjects who were tested. I showed you the 0 and 1 day data, but these are other groups tested after 2, 3, 4, or 7 days, and they continue to get better without any practice. So it's not practice that makes perfect. It's practice plus sleep that makes perfect. And the terrifying finding is that if you sleep-deprived subjects for the first night after you train them, subsequent sleep is of no value whatsoever. So that after 2 full nights of recovery sleep, their performance here is not significantly different from baseline. So you have to get sleep, and you have to get it tonight. There's this concept of sleep bulimia, which is a binge purge concept. College students love it. They binge sleep on the weekends, and then they purge, getting 4 or 5 hours a night during the week. And they tell us that they're fine. They make it up on the weekend. Well, they might make it up in terms of getting back to full alertness, but it's really too late to remember what they didn't remember because they didn't sleep that first night. Now, sleep does much more complicated things than simply make us faster or stronger in our memories. It can do things like enhance verbal memory in some unexpected ways. First of all, for those in the wake group, across the day, they forget about 40 to 45% of the words that the 20-minute group could remember. And even after sleep, they're forgetting about 25% of those words. That's of the words that they actually saw. But when you look at the words that weren't shown, those gist words that the brain came up with, they're still forgetting about 20% of them across a day awake. But across the night, the brain holds on to them tenaciously. It's holding on to the memory of what it thinks is most important. so that when you wake up in the morning, you have a memory that might be less accurate, but more useful in understanding what had happened. Subjects who were trained in the morning and tested that evening without sleep, they get a couple of extra cards correct, but not significantly more than they were at baseline. It's impressive that they remember what they learned, but they certainly aren't getting better. After a night of sleep, they're 10% better. They're doing better on this task after a night of sleep than they were right after they learned it. In a very real sense, these subjects, when they wake up in the morning, have a better understanding of how the world works than they had when they went to bed the night before. And that's what sleep is giving them. So you do need to sleep, or rather, you need to sleep. You need to sleep to maintain alertness and optimal cognitive functioning, to optimize your immune defenses, to maintain hormonal regulation and weight, to prevent beta amyloid buildup and Alzheimer's, to permit sleep-dependent learning and memory consolidation, and as Chuck pointed out, just to be happy. Or, to put it another way, if you don't get enough sleep, you'll end up stupid, fat, sick, and unhappy. The choice is yours. Thank you.
And we know that there's a lot of drama in adolescence, and there's just as much drama when we talk about adolescent sleep. And it really does seem like that 8:30 or later is the sweet spot, both in terms of allowing students to get the sleep they need, but also to get it at the right time that is in concert with their circadian rhythms. In terms of school performance, tardiness rates go down, absenteeism goes down, dropout rates decline, graduation rates increase in schools that have delayed their start times. And grades overall improve, particularly in the morning classes, as you might imagine, but in core subjects like English, math, science. And there's some evidence to suggest that disadvantaged students, students who are in the lower end of academic success, and minority students may benefit even more from school start time change. Standardized test scores improve. And delayed school start times are also associated with improvements in mood. Every single study shows that self-reported symptoms of depression go down. Less visits to the health center. And perhaps most importantly, now there is evidence to suggest that changing school start times can decrease the risk of students being involved in car crashes by as much as 65 to 70% in some studies. Now, as a public health person, it's hard for me to imagine another strategy that could affect mortality, could affect death rates from car accidents as much as this could. And of course, we can't absolutely draw cause and effect from these studies, but the evidence is accumulating that there is this association between later school start times and fewer accidents